I'm Dr. Ariane from the Movement Paradigm. Do you have hip pain that you are continually trying to stretch, roll, smash it, and nothing seems to get better? Before we get into the role of the psoas, let's speak about the local stabilizers and global stabilizers of the body, because this is really important to understand of how you're going to treat your hip flexors, your hip pain. So the local stabilizers, think of those as they are close to the joint. They create more of an isometric contraction versus a concentric contraction or an eccentric contraction, shortening, lengthening. They are going to control joint centration. So that means keeping the joint centered in its axis. And it's also independent of activity of motion. So if I raise my arm overhead, the deep stabilizers in my spine are going to activate before my arm goes overhead. So essentially these local stabilizers are imperative for stabilization in the body so that we can have proper movement. Our global stabilizers are equally as important, however they have a different role. So they are going to have more of a eccentric contraction. They are going to decelerate range of motion. They are going to control motion better. So it's a little bit different than our local stabilizers. They are also farther away from the joint. So now getting back to the psoas, which is what everyone wants to stretch when they have hip pain. The psoas, the posterior or the back of the psoas, is actually a local stabilizer. So this means think of it as one of our deep core muscles that is helping to stabilize the spine and also prevent the femur, our leg bone, from shifting forward in the hip joint. We also, as a global stabilizer, that is the anterior portion of the psoas or the front of the psoas. So it is necessary to really think of the psoas muscle as a stabilizer. And not only is it a stabilizer, but it works in an integrated unit with all of the other muscles, including the pelvic floor, the diaphragm, the multifidus, the deep 5 stabilizers in the hip, the transverse abdominis. So all of these have to work together, and once again in this integrated fashion, to be able to stabilize the low back, the pelvis during any kind of movement. So when we get hip pain, what typically happens? There's lots of different hip pathologies, which I won't get into today, but typically what happens is we lose stability, the deep stability of the hip. And what will happen is there's 2 common muscle imbalances that will exist. One is the TFL muscle, so right in the front side of the hip. It can get tight and it is going to pull, based on its attachment, pull the hip forward. And that will therefore inhibit or shut down the psoas. The other one is the hamstring muscles can get tight for various reasons, and they are going to push the femur forward, and that also leads us to losing that optimal position of the hip joint. So what happens when we have these muscle imbalances over time? Think if the hip should be centered in the axis like this is called our joint centration. What will happen is the hip will start to shift forward and up. Forward and up. And then we begin to have all types of pain issues and pathology, whether that's a labral tear, whether that's a hip impingement, a tendinopathy, bursitis on the side, and so on. So what we have to think about is how can we get that hip to stabilize? How can we get it centered in the joint so that we can really make sure that we're decreasing pain, of course, but ultimately improving function? So how you're going to do this is a 4-step process. We use this in EBFA Global's barefoot training programs, and this is a great way to begin to address your pain as well as any kind of movement compensation, and most importantly, integrate your foot with your core in a very integrated manner. So you're addressing this through these 4 key ways of inhibiting the tissue. In this case, we inhibited the TFL muscle that typically pulls the hip joint forward and creates that inhibition of psoas as a deep stabilizer. Then we're going to mobilize the hip joint. So we're going to center the hip joint. Remember that when it is not in that centered position, it's shifting forward and up. So we're shifting it back to that center position. Then we're stabilizing it. We're activating with the deep stabilizers. So our diaphragm, pelvic floor, etc. Then we're integrating it with the ground. Super important, the foot is part of the core and they work as an integrated unit. So in order to really get those deep stabilizers of the hip firing, we're doing short foot, which is using that foot to core sequencing and doing that once again in a very integrated fashion.
For the TFL release, you're going to place the ball right on the outside of the hip. When you lie down, you'll naturally rotate the hip in, which will expose the TFL muscle. The other leg, you're going to anchor up at a 90-degree angle. Come down to your forearms, and then holding that position, your leg will be nice and long, naturally rotated in, breathing throughout the exercise, really trying to relax into it. For the hip mobilization with band, you'll place the band high up in the groin. You'll have it back on a 45-degree angle away from you. So you'll start off in a table position, rocking forward 15 times, making sure your spine stays nice and long and you're breathing. Then you'll rock away from the band, so to this opposite side. Once again, about 15 times, making sure you're breathing throughout the exercise. Now it's time to activate the deep core. So you can do this by diaphragmatic breathing, inhaling, breathing all the way into the abdomen, the base of the pelvis, allowing the abdomen to expand 360 degrees, and exhaling and letting the abdomen contract, belly button in towards the spine. Once you feel like you have this established, then on your inhale, allowing the pelvic floor to relax, you can exhale and gently lift the pelvic floor, about 20% contraction to really get a deeper integration. You want to think of this as a rhythmical balance, so nice and fluid, inhaling to the base of the pelvis, exhaling, gently lifting the pelvic floor. Lastly, it's time for integration. This is to be done with short foot. So standing on one leg, sitting the hips back, knees slightly bent, taking a breath in while your foot's relaxed, and then exhaling, gently rooting the tips of the toes into the ground. So that will naturally lift the arch and lift the metatarsal heads or ball of the foot. This is a side view. Once again, that nice athletic position, sitting the hips back, inhaling, relaxing the foot, exhaling, gently rooting, and if you'd like, lifting the pelvic floor.
So whether you have hip pain, you have hip tightness, you're constantly stretching your hips, hopefully this video will give you some little bit of education to allow you to really think about your hip differently and recognize that it is part of an integrated unit. And it is really important to understand how that works as it relates to stabilization and movement. You have to stabilize before you move, otherwise you'll be at risk for injury. So as always, thank you so much for joining. If you have a comment or a like, please make sure to drop it in. I'd love to hear, especially if this helps you. And thank you for tuning in each week. Please make sure to subscribe to our YouTube channel, The Movement Paradigm, for weekly tips on mindset, nutrition, and movement.